Hello and welcome to Module 2, Lesson 1, About Teams. This is the first lesson of the second module of the Integrated Care for Behavioral Health Paraprofessionals course, which has been developed by the Grow Our Behavioral Health Workforce program of the Center for Health Innovation. The purpose of this lesson is to introduce core concepts about teams in healthcare, including defining teams, characteristics of effective healthcare teams, and stages of team development. The lesson objectives. Students who successfully complete this lesson will be able to define team, describe at least 4 characteristics of effective teams, and describe typical stages of team development. Keywords and concepts to look out for as you read the module and follow the video include outcomes, patient satisfaction, processes, team, and validated. While these terms may seem familiar, we want you to be aware of their specific knowledge in the integrated care context. Lesson outline. This is a robust lesson, so bear with me, but we'll be covering first what is a team. Then we'll look at what makes teams effective with different subsets that we'll discuss, including shared goals, clearly defined roles, mutual trust, effective communication, and effective handoffs, and finally measurable processes and outcomes. Then third, we'll look at team development. How do teams develop and become highly performing teams that our patients deserve? And finally, lesson summary. And don't forget to check your understanding, as always, with the self-assessment quiz at the end of the lesson. You may take the quiz as many times as you'd like, but you do need to pass it with 80% in order to proceed to the next lesson. And references are available for you as well. So let's get started. First, what is a team? Teams work together in schools, workplaces, and in the field to capitalize on each other's strengths to accomplish goals. You've probably been part of a team ranging back from early preschool or kindergarten days when you might have played Red Rover. You might have worked together with other kids in your classroom to create a drawing or a painting. Those are all teams because you are all working together to achieve a common goal. And that's the key bit of the definition of a team. A team is commonly defined as any 2 or more people working together toward a common goal. And to risk an old cliche, there is no I in team. We need to remember that when we're working on a team, the goal is the most important thing, and everybody has to play their own role. In healthcare, however, teams are a relatively new concept. It's not that we haven't worked as teams throughout the day with healthcare, but traditionally, healthcare has been provided by a doctor who made the decisions about the patient's care, and nurses, medical assistants, allied health professionals, other people who were on that type of team were simply following what the doctor decided. That was like the locus of control. And so their job was to provide support for carrying out the doctor's decisions. And that attitude has changed as the importance of the roles of all of the other people involved in healthcare has become more apparent, especially the importance of the patient. So the role played by each medical professional, allied health worker, office staff, and other caregiver is really starting to be recognized and validated. And by validated, I mean it is being shown to be important, truly. Healthcare teams have some special characteristics, however, that are a little bit different from the Red Rover team that you might have experienced in kindergarten. And so we want to look at that. and especially in the integrated behavioral health and primary care setting, we've got a lot of different challenges and things to look at in terms of the team. Back to the Agency for Healthcare Research and Quality with its Integration Academy. They've defined a team in this way. A team is two or more people who interact dynamically, interdependently, and adaptively toward a common and valued goal, have specific roles or functions, and have a time-limited membership. During the temporal life of a team, the team's mission is of greater value than the goals of the individual members. So, a lot of fancy language in there. Let's take a few minutes to break that definition apart. First, a team is made up of two or more people. And sometimes in healthcare, you can see teams that might involve a handler and a service animal. So that too is a team. The people on the team coordinate their work. So all of the work is done in a coordinated fashion rather than one person doing some of the work and nobody else knowing that that's happening. The team shares a goal and everyone on the team values that goal. Each team member has a specific role or function. Even if you might have a lot of different capabilities and be able to perform a bunch of different roles, when you're working on a team in a specific set, your specific role on that team needs to be defined. Membership on the team is temporary, and while the team is functioning, the team's shared purpose is more important than that of any individual team member. That's kind of how we can break down that AHRQ definition with a little bit more accessible language that we can look at. Here's an important distinction. You need to know the difference between teams and groups. They are not at all the same. A group can achieve its goal if everyone in the group makes an independent individual contribution. So a group of people might come together to create a potluck. A team requires real-time coordination of tasks between individuals. The team might be the people who all work together in the kitchen to create lunch to serve 200 people. So that's the distinction that we want to be able to maintain throughout this. And an integrated care team really truly has to work together in a coordinated way toward a shared common and valued goal. In healthcare, the team includes anyone involved in the process of patient care who can take action, including the leader. Every member has a clearly defined role and responsibility, and everyone is accountable to the team for their actions. Importantly, if you are part of a healthcare team, you must stay continually informed for the team to function effectively. You need to know always what have been the latest decisions about care, about this patient's well-being, about what's going on with the patient, and so you need to stay up to date with that. Effective teams. Effective teams have 6 characteristics, and we will go through these one by one, but I wanted to share with you the overall vision first. So let's look at shared goals, clearly defined roles, mutual trust, effective communication, effective handoffs, and measurable processes and outcomes. All of this is detailed, and don't forget to read the HTML page that comes with this lesson. So you'll find a lot more detail than in this, but let's review it really quickly. Shared goals. Team members work for the patient. The patient owns the team. Every member of the healthcare team, including the patient and, when appropriate, family and caregivers, needs to understand the patient's goals and make them their own. Every patient has different needs and goals, even if they might have the same quote-unquote diagnosis, and team members need to be familiar with each patient's story. And remember that the patient's treatment goals are part of their life goals. consider 3 patients struggling with an opioid use disorder. They may all have the same diagnosis, but their goals for recovery might be very, very different. Patient 1 might want to have a healthy baby. Patient 2 might want to go climb Mount Everest. And patient 3 might want to finish a master's degree. But they're all struggling with opioid use disorders, which get in the way of them achieving any of those goals. So their life goals are impacted. So as you're thinking about this, pause for a moment. Go ahead and pause the video and write down a couple of ideas. How do these different life goals affect the resources, support, and treatment that each patient needs? And what other issues might need to be addressed for each one of these patients? Might there be issues in their daily lives and housing and their other resources? Relationships? So what are the issues that might come to bear on this patient's treatment? Addressing tensions. Inevitably, as a team works together, problems will arise with personalities, processes, and symptoms. The most important thing that you can do as a team member is not to go off and start griping about somebody else. Well, Dr. So-and-so did this, and can you believe she? Avoid that. Instead, stay focused. Why are you here? Recognize everyone is working for the patient. If you do have to have a difficult conversation with other team members, and those happen, focus on improving processes and systems. Hey, Susie, if you could help me out by doing X, and if we did that all the time, that would be really great. So let's improve our process. Everyone on the team needs to be able to voice concerns and make suggestions for improvement without fear of being ridiculed or yelled at or dismissed. That their voices everyone needs to know that their voice counts, and it does not matter what their position. Clearly defined roles. Effective teams recognize that each team member plays a unique and important role on the team. And team members need to know their own roles and the roles that others play. Really, really important. I worked for many years on an ambulance service, and I had to know what my first responders could do, what my EMT basics could do, what my drivers could do, what the intermediates could do, what the paramedics could do. We needed to know so we could make the best use of those teams. And by knowing everybody else's scope of work and what they were capable of doing within that scope of work, we were able to provide much better care for all of our patients than if I had had no idea that, a first responder could actually give that oxygen or give that other medication. So I think it's really important that we recognize everybody needs to know not only what we can do, but what others can do, what those roles are. And we'll talk about that in the next lesson. Remember that healthcare team members usually come from different backgrounds, training programs, and geographic areas. So there may be cultural, both professional cultural differences and local cultural differences in the way that they interact. It may be just as simple as how quickly somebody speaks. So cultural and organizational norms may affect how team members interact. And team members must learn what skill sets and experience each team member contributes to achieving the shared goals. So get to know your team members and know what they're capable of and be really clear about who's responsible for what. Leadership. Every team needs a leader. Without a leader, people flounder if they try to have a team. That doesn't mean a boss. Leadership is not based on hierarchy, and physicians are not always the best person to perform a particular task, especially run meetings. The person who runs team meetings doesn't necessarily have to be responsible for clinical decisions. They just have to be really good at running meetings and getting people to talk and facilitate. Choosing a team leader requires knowing the training and skill sets of all team members and determining who is the best leader for a particular task. You may have leadership in different areas. Standing orders, one of my favorites. Definition time. A standing order is a written protocol that authorizes specific members of the healthcare team to perform certain tasks. For instance, nurses may have standing orders that allow them to give certain vaccinations to kids as long as there aren't any contraindications. In EMS, we often worked on standing orders because we couldn't reach people at the emergency room, the doc on call, because of distances and topography. So a standing order says, in this case, you do A, B, C. Some of the tasks that might be covered by standing orders: routine vaccinations, as I've mentioned, renewing prescriptions, or ordering routine screening tests. So often by using those, you can take the onus off the physician to do all of that, and the other members of the team can do some of those more administrative tasks. Some sample assignments: the front desk might be responsible for entering orders for labs, x-rays, and referrals, or notifying patients of normal test results. If the test results aren't normal, then maybe that task gets delegated to a nurse or the physician, him or herself. Medical assistants might be responsible for weighing patients, taking vital signs. That's just a standing order. It's how you do it. So that's one way that roles and responsibilities can be clearly delineated without having to ask permission of the physician leader every single time. Paraprofessionals. Talking about clearly defined roles. Behavioral health paraprofessionals may need to inform other team members, including patients and family caregivers, about their training, skills, and competencies, because they might not know how to work with them. Providers and other team members may need education about the paraprofessional scope of work, what you can and cannot do. I've seen it in clinics. Suddenly the community health worker is asked to perform a task that they're not trained to do, like administering a vaccine, that falls underneath the rubric of the medical assistant. They can mix those up. Conversely, I've seen sometimes physicians say, oh, no, you can't do that, when there is something that's perfectly within your scope of work. And remember that paraprofessionals often work mostly in the field. You do so many home visits, you do so many things out there, and other team members aren't present to watch you in action. So they don't see you, and they don't really understand what you do. So you should be sure always to introduce yourself to other team members by name, describe your role, and be really clear about what it is that you do, not only to the patient, who is, of course, a team member, but to your other medical and behavioral health providers on the team. Mutual trust and respect are the threads that sew teams together and allow team members to rely on each other. When team members trust and respect each other, each person can do their best work. If you know that if we're on a team together and you know that I am really good at bringing cookies, you're going to trust me to bring the cookies, right? So be sure that you know what people's capabilities are, and that's how we build trust. And so I might go and say, you know what, Juana's got this one. I know, perfectly trust her. When she went out into the field and she said that my new patient David was having a crisis, I completely believe her, and on we go. But we need to have that mutual trust and respect so we're not second-guessing each other, and we can really truly work in an interdependent way. Integrity and interdependence are essential to high-functioning teams. Team members depend on each other's integrity. Integrity, definition time here, is defined as being competent, honest, and doing your best to succeed. So, knowing that you have the skills, you're competent, that you're going to be honest about what it is that you can and cannot do, and that you are going to do your absolute best to do whatever it is to fulfill your role in your task. When we have that basis of integrity on a team, when all of those people working on that team have demonstrated their integrity, that's when team members can become what's called interdependent, as opposed to dependent on each other or independent, like a group functioning. They're interdependent. So they rely on each other's skills to achieve a greater whole, rather than acting on either side of that spectrum. So because you can do your job, I can do my job, and now we're going to achieve something that we couldn't achieve separately. They learn from each other, and then they build on each other's assessments and conclusions. So this is when you've built interdependence, you go out into the field and you determine something about your patient that they might need some help. You come back and bring it to the team. They build on your assessment. They don't have to second guess it. And so those making of decisions without second guessing, well, were you really right? Do I need to go see for myself? Which is different from saying, oh, thanks for bringing that to my attention. Now let's bring Dave in because you say that he needs his help, so I can give him that complete diagnosis because I believe your assessment. So that's mutual trust and respect. That's that integrity and interdependence that makes teams work. Effective teams have effective communications cannot be emphasized enough. Healthcare communication is too often like the game of telephone. Remember that one where somebody whispers in one person's ear and then you keep whispering around the room? You pass that whispered message, and by the end, the message is so scrambled, it's nothing like the initial message. It's good for a lot of laughs when you play it at a party. But in a healthcare team, poor communication too often leads to medical errors and compromises patient and team member safety. So communication is so essential. The more people on the team, of course, remember, the bigger the circle of telephone, the greater the risk of error. So that's why we use things to reduce the risk of error. Because in the integrated care setting especially, communication can become more difficult. Teams are bigger because you've got all these different disciplines working together, right? So that just makes it harder to make sure everybody hears the same message. And secondly, they come from different backgrounds, different trainings, might use different language for the same things. So it can make it really hard. So solid methods for communication need to be established to make teams work. And you as a paraprofessional are part of that. That infrastructure can create effective communication. Regularly scheduled team meetings that include patients and families. Once a month, once every 2 months, depending on the patient's status. Get the team together, including the patient and any caregivers or natural support folks that the patient wants there. And schedule those meetings regularly. So you're checking in and everybody can have that information. In the clinic, daily huddles. In healthcare, a huddle is a brief meeting, 10 minutes or less, that is typically used once at the start of each workday or each major shift. Just like the football huddle or any other huddle, it's a time to go, okay, touch base, what are we going to do? Let's plan things out. How are we going to address this patient, that one? And make sure everybody's on the same page before you break off to go literally play the game for the day. Written communications, we still have paper and pen, although most communications in healthcare are now digital. But write things down, of course, with HIPAA protection in mind. And digital communication tools such as electronic health records, encrypted emails or text messages or phone calls. So when we're using digital communication tools, we'll go back to our other course and remember that they must be accessible by everybody who needs that information. And effective communication not only depends on infrastructure, it also depends on skills. Effective communication is skillful communication. Some of the things that you can do as a team member, whether you're communicating with the patient or your colleagues in healthcare workers, Use active listening. Listen carefully. Don't interrupt. Watch the person's face. Watch their body language. Pay attention to your team members' body language and to your own, too. If you're listening and you're distracted, looking at your cell phone, doing other things, you're conveying that you're not there. So listen actively. Confirm what you have heard. So if you are the one delivering the information, check in, confirm that they heard and understand what you've just said. So you might say, hey, so we just agreed that I'm going to accompany you to your appointment next week, right? Tell me, what did we just agree to? Have them repeat it back to you. If you're on the receiving end of information, confirm what you have heard, especially if your patient shares some sensitive information. Use that check-back technique to close the loop on communication. Speak up. When conversations get difficult, speak up respectfully. Try these techniques to get through difficult conversations productively. First, prepare yourself and the other person. People usually know when things have gotten weird, right? So give them there's something I want to talk with you about. I know you're busy, but could we speak briefly at lunchtime or after work, or is there a time we could talk? So don't just try to grab that person and have that conversation in the middle of a busy work day. That will never go well. Listen and ask questions. Be curious. If you're having a difficult conversation, bring curiosity to it. Why did that other person act the way they did? Why? Think about that question like a 2-year-old. Allow silence. If things become uncomfortable, if someone needs to think something through, allow silence without interrupting. 30 seconds can seem like forever, but it might be just what's needed for someone to process. Use open-ended questions. Put on your journalist hat and begin your questions with the 5 W's plus H. When, what, where, why, and how. That was 4, wasn't it? But remember, that journalist can always help bring out your own inner journalist. Effective teams have effective handoffs. Handoffs are one of the most dangerous parts of healthcare because if communication is not stellar, people can get into trouble. ISBAR is an acronym. There are several, but ISBAR is one of the easiest acronyms to remember about handoffs. ISBAR stands for Introduction. Who are you? What is your role? Where are you? And why are you communicating? So, hi, I'm Julie. I am a community health worker, and I am currently at the home of X patient, and I'm calling because X patient is in need of something. Situation, what is going on with the patient? What's the clinical background or context? What do I think the problem is? And then finally, recommendation and request. What are you asking for? As we move forward with this, I ask that you please review the use case in the text that gives a scenario, and then think of some of your own experiences with patient handoffs. Has there been a time when you've been needing to hand off the care of a patient to somebody else? How have you handled it? But using the ISBAR framework, pop it up somewhere on the inside of your glasses, can help make sure that you communicate all of the necessary communication if you are doing a handoff for a patient. Finally, measurable processes and outcomes. You need to know whether you're being effective, whether what you're doing is working. The only way to know is to measure both your processes, which is how things are done, and outcomes, what happened as a result of those processes. Remember, definition time. Processes, how things are done. Outcomes, what happened as a result of those processes. Most organizations also measure patient satisfaction and team function. So you may be asked to ask about some questions pertinent to that. Behavioral health paraprofessionals are asked to gather information that helps to determine team effectiveness, and this requires careful documentation of events and full participation in meetings. One thing that you may be asked to measure are patient care processes. How does the patient move through the system? Is it efficient, safe, and effective? How does the process affect patient outcomes? Some of the measures and the questions you might be asked is, how long does it take a patient to schedule an appointment with a provider? How long a patient had to wait to fill a prescription? Whether a patient received a reminder notification? Whether a provider received a notification about a change in patient status. Patient outcomes. We want to know, is the health care that the patient receiving effective? Is it helping them to manage disease and overall be well? Generally, outcomes are measured using a validated tool that is administered by a clinician. In this case, validated, definition time, means a tool that has been tested and used enough that the researcher believes that the instrument actually measures what it was designed to measure. So it might be a depression scoring tool, it might be something, but it's been used enough and then lined up with results that we've got a pretty good feeling that it's an accurate measure of whatever it is you're trying to measure. Other things that you might end up measuring: patient and family satisfaction. How happy were the patient and their family with the care they received? Was it culturally and linguistically appropriate? And was it health literate? Did they understand when they walked away so that they could act on it? Team function. How well does the team function? Tools to assess team function include team steps from the AHRQ and team development measures. Effective teams and paraprofessionals. Paraprofessionals play a critical role in assuring that the healthcare team is effective. They help assure that care is culturally competent. They help patients navigate the health system. They help establish trust with patients and other workers. And they advocate for appropriate payment by health insurers. Part 3, Stages of Team Development. Tuckman's stages of team development have been used since the mid-1970s to help to, actually since the 1965, to help to understand team dynamics and what makes teams effective, what makes them tick. In 1977, he started in 1965 with the 4 stages: forming, storming, norming, and performing. And in 1977, Tuckman and doctoral student Mary Ann Jensen added the 5th stage, called adjourning. So we now have 5 stages of team development that can help you to understand where you are in terms of your healthcare team. During the forming stage, team members meet. In the healthcare setting, these might be the people you work with every day and you see at work, but you've never come together in this particular way to care for this particular patient. So that's when the team forms. So they meet with this new goal of working for a particular patient. Team leaders facilitate introductions and highlight each person's skills and background. And then team members are given details about the patient's condition and desired outcomes. This is the time to organize responsibilities and clarify roles. Who's going to do what? And how are you going to be held accountable? The next phase that often happens during teams is called storming. This is that idea generation. It's kind of like brainstorming, but sometimes it can be difficult storming. Team members openly share ideas and use this stage as an opportunity to stand out and be accepted by their peers. Interpersonal conflicts arise during this stage, with conflict often rising to the surface. Team leaders help teams in this stage by having a plan in place to manage competition among team members, make communication easier, and make sure projects stay on track. As a paraprofessional and a team member, you can help by simply listening, watching, and not getting engaged in any kind of tension. Finally, teams that get through that storming phase move on to the phase called norming. They've learned how to work together. They have that common goal. There's no more internal competition. Their responsibilities and their goals are clear, and each person works more efficiently because he or she has learned how to share ideas, listen to feedback, and use their skills. Finally, teams achieve the performing stage. There's a high level of cohesion and trust. They've achieved that interdependence that we talked about earlier because they know about each other's integrity. They function, each individual team member functions at peak efficiency because they know their role and they act on it. And yes, issues still come up, but teams have developed strategies for resolving problems, and they're able to retain that focus on the goal of the patient's health. Finally, after the team task is done, the team adjourns or pauses until it is needed again. In the integrated healthcare setting, there often is no done. The full team may adjourn once the patient is stabilized. At this point, teams debrief on what went well and what could be improved for future patients. Lesson summary, a quick recap of what we've just discussed. What is a team? A team is commonly defined as any two or more people working together toward a common goal. Teams are not the same as groups. A group can achieve its goal if everyone in the group makes an independent individual contribution. A team, on the other hand, requires real-time coordination of tasks between individuals. In healthcare, team members include anyone involved in the process of patient care who can take action, including the leader, have clearly defined roles and responsibilities, are accountable to the team for their actions, and must stay continually informed for effective team function. Effective teams. Research about teams in healthcare shows that effective teams share the following six characteristics: shared goals, clearly defined roles, mutual trust, effective communication, effective handoffs, and measurable process and outcomes. Team development. The 5 stages of team development are forming, storming, norming, performing, and adjourning. Be sure to check your understanding before you leave this module or this lesson. Here's some references and resources that you can use to explore further the fascinating world of teamwork. This has been Module 2, Lesson 1, about teams, of the Integrated Care for Behavioral Health Paraprofessionals course, which has been developed by the Grow Our Behavioral Health Workforce program of the Center for Health Innovation, with funding from the Health Resources and Services Administration. Thank you for your time.